Welcome to the Advancing Surgical Care podcast, brought to you by ASCA, the Ambulatory Surgery Center Association. ASCA represents the interests of outpatient surgery centers of every specialty and provides advocacy and resources to assist them in providing safe, high-quality, cost-effective patient care. As with all of ASCA's communications, please check to make sure you are listening to or viewing our most up-to-date podcasts and announcements.
Hello, and welcome to the Advancing Surgical Care podcast. My name is Charlie Leonard. I'm a member of the ASCA Public Affairs team and host of this recording. In a moment, I'll be joined by Maia Kunkel. Maia is a manager of government affairs here at ASCA, and while August may be vacation time for some, it's one of the busiest times of the year for Maia, who coordinates National ASC Month activities, arranges and helps plan surgery center tours for elected officials, enlists the support of members behind ASCA-backed legislation in Congress, manages ASCA's annual Washington fly-in, and much more. So with lots to discuss, I'm pleased to have Maia back on the podcast. Maia, welcome.
Thank you, Charlie, for having me.
Maia, let's talk about the Washington fly-in first, since I know the registration deadline is fast approaching. Can you give us a full rundown? Let's talk about dates, registration, travel, lodging info, as well as what we hope to accomplish that week.
Yes, ASCA will be holding its annual National Advocacy Day this fall, September 15th through 17th in Washington, D.C. It's a great opportunity for ASC professionals from across the country to gather to advocate directly to the members of Congress, educate them on the high-quality, lower-cost care surgery centers provide, and make sure that they are informed about the issues currently impacting the ability to provide care. ASCA schedules a full day of meetings for each participant, provides training ahead of the day of meetings, and provides helpful materials on ASC issues and legislation. Throughout the year, ASCA advocates on behalf of its members at the federal level, but there really is no substitute to your day-to-day ASC experience and expertise. Registration is now open through August 15th on ASCA's website. The National Advocacy Day website also has more information about a Delta flight discount and a room block at the Thompson, Washington, D.C. hotel. Looking forward to seeing many of you, hopefully in D.C. this fall.
Maia, I would add, don't take our word for it. If anyone listening is interested or intrigued by the idea of coming to Washington to lobby that day, get in touch with another ASCA member who's been, because universally people come away with just a great experience and really feel like they've made a difference. And so I, again, encourage people to learn more about what we have to offer on the website, but also talk to other ASCA members.
Absolutely.
Maia, we need to pause here to hear a short message from our podcast sponsor. Stand by and we'll be right back.
This recording of the Ambulatory Surgery Center Association is being brought to you by Surgery Partners, a leading operator of surgical facilities and ancillary services with more than 200 locations in 33 states. Surgery Partners offers multiple types of healthcare services that deliver high-quality healthcare in a convenient and cost-effective manner. To learn more, visit surgerypartners.com.
Maia, earlier this year, ASCA promoted the introduction of legislation in both the House and Senate known as the Medicare Beneficiary Copay Fairness Act. It's a bit of a mouthful, but in a nutshell, this legislation would eliminate the copay penalty experienced by Medicare beneficiaries who undergo procedures in ASCs. This change of law is needed because currently, Medicare Part B patients have their copay capped when they are treated in hospitals, but not so in ASCs. We've seen support growing every day, but now we need ASCA members to join the advocacy effort behind this essential legislation. Maia, if members can't participate in the fly-in and lobby Congress directly, what are the other ways they can help build support with their local representatives?
Absolutely. We know that not everyone is going to be able to travel to D.C. this fall to meet with their members of Congress on Capitol Hill. So ASCA has created some sample template letters that you can submit to your members of Congress from wherever you are to help garner support for the Medicare Beneficiary Copay Fairness Act. You're right, Charlie. That can be a mouthful. There are letters for lawmakers in both the U.S. House of Representatives and U.S. Senate. So if you're interested in participating and learning more about our letter writing campaign, please go to ASCA's Get Involved webpage for the direct link to participate. If you go to the campaign and fill in your information and one of your lawmakers does not pop up on the screen to send a letter to them, that means that they are already a supporter of the bill, which is great.
Yeah, and we at ASCA and representatives of ASCA lobby Congress all year round, but we can't emphasize enough the importance of ASCA members at the local level getting in touch with their member of Congress or their senator. And it's as easy as a phone call, an email, or writing a letter, because that just has so much more impact than hearing from an organization based in Washington. Would you agree?
Absolutely. Yeah. There really is no substitute for your day-to-day experience in an ASC.
Maia, throughout the year, as I said, all of us at ASCA spend considerable amount of time and resources helping to raise awareness about the role that outpatient surgery centers play in the healthcare system, as well as the benefits we provide to patients and payers alike. Can you talk for a moment about how the National ASC Month affords ASCA members the opportunity to promote the care and benefits they provide, as well as the resources that are available to assist an ASC interested in helping with these types of promotions?
ASCA has created social media banners, email signature graphics, virtual meeting backgrounds, and general information on the ASC model for everyone to download and use to promote National ASC Month, spread the word of surgery centers, and help celebrate 55 years of ASCs. We have all the information on how to get more involved compiled on the National ASC Month webpage. So if you go and visit there, you can be able to download those, participate in all of our campaigns that we have going on, share the message of ASCs to your lawmakers, patients, and the public at large.
I want to add to that as well, anyone listening. We're not asking that you do all of these things, though that would be terrific if you did, but take the time and involve some of the staff at the ASC. Get online, look at what we have to offer, help us out with one or two of these tactics because they'll make a big difference for us across the country, but also to raise your awareness within your market.
Definitely. And if I can add one more thing, if anyone has any photos that they take throughout the month of your staff celebrating at your facility, we always love to post those on our social media pages, spread the word of how other people are getting involved throughout the month and celebrating.
Maia, let's also talk about surgery center tours for members of Congress and their staffs. These have become a critically important part of our overall advocacy efforts. Since hosting a tour is probably outside the skill set of most surgery center staffs, can you talk about how you and others at ASCA provide hands-on help with things like the invitation, messaging, and more?
Sure. Facility tours are an awesome way to invite your lawmakers into your ASC to get a glimpse into a day in the life of the surgery center and the staff that work in surgery centers. So for a lot of elected officials, they haven't visited an ASC before. So it's very informational for them to not only be educated on the ASC model, but understand the vital role that these small businesses play in their communities and the care that they provide to their constituents. I completely understand that if you have not done a facility tour before, hosting a tour may seem like a daunting task and you're not really sure what all that entails to meet with an elected official. But ASCA staff are here to help you throughout the process, and we handle all the outreach, scheduling with the lawmaker's office, and we have materials available with talking points to reference during the tour. ASCA staff also offer guidance on how to conduct a facility tour and best practices, and are here to answer any questions that you may have throughout the process. A facility tour is focused mainly on your day-to-day experience, what's going well at your facility, but it's also an opportunity to talk directly with a lawmaker about any problems that you may be experiencing with individuals who may be able to help. So whether that's things like Medicare reimbursement, staffing, or anesthesia issues, you never know what will help be a catalyst for positive solutions.
Maia, so much of our advocacy involves comparing ourselves to hospitals and hospital outpatient departments and trying to align our payment with their payments. Often when we can get a member of Congress or their staff to visit an ASC, they leave and say, wow, that looks just like a hospital operating room. Because we are just like a hospital operating room and we're providing the same level of care that's afforded in an outpatient department and in a hospital. And just having that personal experience of having them see and touch and feel and get to know the staff at an ASC can make all the difference when we go to make those arguments in a legislative setting.
Definitely. And as I said, a lot of times when lawmakers are visiting ASCs, this would be their first time visiting a surgery center, so they may not fully understand what types of procedures are done in ASCs, the types of patients that are typically seen. So it's really enlightening for them to fully understand the model and the care that ASCs provide.
Maia, that's all the time we have for today. I want to thank you for spending a few minutes with me and for all of the advocacy and government relations work you do throughout the year.
Thank you, Charlie.
Now, before concluding, I would like to acknowledge the support of our update sponsor, Surgery Partners, a leading operator of surgical facilities and ancillary services with more than 200 locations in 33 states. Surgery Partners offers multiple types of healthcare services that deliver high-quality healthcare in a convenient and cost-effective manner. To learn more, visit surgerypartners.com.